is Alexandra. Today I'll be doing my neurovascular assessment video. Today I'm in school uniform, no jewelry or no nails. Here I have a pen, a Q-tip, a paper clip, and a watch, as well as my stethoscope for today's supplies for the assessment. Here I have my patient. I will first begin by verifying the physician's orders. I would then go ahead and make my way to the patient's room. So I'll knock on the door, close curtain for patient privacy. I would then perform hand hygiene and introduce myself to the patient. So, hi, my name is Alex. I'll be your nurse today. And then I would ask for the patient's name and date of birth. So, may I please get your name and date of birth, guys?
Esmeralda Esparza, 52584.
Thank you. I will then check the patient's wristband to verify for two patient identifier, and then explain to the patient what we'll be doing today. So, okay, Ms. Esparza, today we're going to be doing the neurovascular assessment on you. I will basically be touching some parts of your body. Your eyes will be closed to get a elicit response. Is that okay with you?
Yes.
Okay, so we're going to start with the perception of dull or pain using, I'll be using the Q-tip for this assessment. And, okay, so you're going to close your eyes and you're going to tell me if it's dull or pain, okay? This is dull and this is pain, okay? We're going to be doing this 2 times on each side. So we're going to go ahead. Ready?
Dull. Pain. Dull. Pain.
Perfect. So now she verified the correct responses. So now we're going to move on to the perception of positions. So I'm going to go ahead and get your fingers and toes, and I'm going to move them up and down. You're going to tell me if it's up and if it's down. We're going to be doing this on the upper extremities and lower extremities bilaterally. So go ahead, close your eyes.
Up, down. Up, down. Up, down. Up, down.
Perfect. So thank you. She was able to identify which way it was going, which was correct. I'm sorry. So now we're going to go ahead and keep your eyes closed, and I'm going to go ahead and give you an object that you're familiar with, and I want you to report back what you think the item is, okay? So go ahead and give me your hand, and let me know what you think. Identify what you think the object is.
A pen.
Perfect. Thank you so much. So since she identified the correct object, we're going to go ahead and do the 2-point discrimination using a paper clip. Okay, Mrs. Barza, so I'm going to use this arm right here, and basically what I'm going to do, you're going to continue to have your eyes closed, and I'm going to use this object, and I'm going to touch you with it with 2 points, and it's going to move closer and closer. You tell me out loud if it's 2, 2, up until it gets to 1, okay?
Okay. 2, 2, 2, 1.
Perfect. Okay, so I would measure the distance between, and then I would also document my findings. Now I'm going to go ahead and move on to drawing a letter or number on the patient's hand. So again, your palm's going to be up, and I'm going to draw with the Q-tip a number or a letter, and you let me know what the number and letter is, okay?
7, 3, 4.
Thank you. Okay, so now I'm going to touch different parts of your body with your eyes being closed, and you're going to let me know what parts I'm touching, again, keeping your eyes closed, okay?
My shoulder. My right knee.
Okay, sounds good. Thank you. So now you can open your eyes. Now we're going to do the deep tendon reflexes. We're going to do the bicep tendon. Again, we're going to go ahead and use my stethoscope for this. So supporting the arm, we're going to hit the stethoscope on my thumb. And we're basically we're watching for a reflex. So go ahead and relax your arm. Ready? And perfect. Thank you. And 2+ is considered normal for this assessment. Now we're going to do the patella tendon. For this assessment, you're going to want to make sure that the patient's leg is relaxed as well as dangling, so you can see the reflex. We're going to go for that patellar tendon, right? And we're going to go ahead and hit it to elicit response. Thank you. Now we're going to move on to the ankle conus. Basically, this is a rapid response movement of the ankle, And we're trying to see if there's tremors. So we're gonna go ahead and go like this, and if the patient's foot drops, then that means that there's no tremors. We don't want any tremors. But if there's kind of like a stutter, that's tremors present. Now we're gonna do the cerebral function and proprioception test. So now we're gonna go ahead and have you put your arms out, and you're gonna touch your nose like this with your eyes closed. I'll tell you to go faster, okay? Go ahead. Alternating, yep, go faster. Perfect, thank you. Oops, sorry. Okay, the next one is the rapid alternative motion with the upper and lower extremities. So you're gonna go ahead and again, keep your eyes closed, and then you're gonna go ahead, well, let me demonstrate with you first. You're gonna go ahead and go like this on your lap, okay? With your eyes closed, I'm gonna tell you to go faster, okay? And begin. Faster. Perfect, okay. Now you're gonna go ahead and stand up, and you're gonna jog in place.
Eyes closed?
No, you can just jog. Perfect. You can go ahead and sit down. Oh wait, no, stand, sorry. Now we're gonna do the Romberg test. So basically you're gonna go ahead and stand. I'm gonna start with your eyes closed, hands on your side, and go ahead and start. So it's supposed to be for a minute, and basically I'm assessing for any swaying. And a little bit of swaying is okay, but if there was any, if there was a lot of swaying, then it would be technically a neurological issue. And I'm here for safety and for support, so I'm just waiting for the minute to be done. And yeah. Okay, so there was no drastic swing, and that's good. So now I'm gonna assess your gait. So I'm gonna have you, I'm gonna assess for her posture, gait, as well as rhythm. So I'm gonna go ahead and have you walk to me, and then walk back. Go ahead. Okay, go ahead and come back and sit. So the patient's gait was normal, and her posture was fine, or her posture was okay, and she had a steady pace. So now I'm gonna do the Babinski reflex. So basically I'm gonna take her foot, and I'm basically going to be going lateral to media. We don't wanna see curling, because that would be considered an issue. The banding out would be okay. So again, taking my pen, you're gonna start from here, all the way there to the bigger toe. And that's it. Thank you so much.